videos. Sometimes it's necessary because of the internet issues, especially here in our region. So if someone fails to put their video off, maybe until the very end, that would be great, except maybe for the presenters. So I'll start by just welcoming everyone of us who is here, and maybe those will be joining as we proceed. And as we had agreed in our last meeting that we had, some of us attended. That should have been way back in possibly March, after the East African Network forum that we had here in Nairobi. We agreed that we want to keep connected and engaged as civil societies in this region of East and Central Africa. Well, right now it's just East African Network, because the central bit, which was DRC, is now officially part of the East African community. And just for a highlight, for those who may be joining us, maybe for the first time, the East African Network on Crime and the other bit of drug prevention and treatment and recovery, and over time has also, considered the aftercare integration approaches, was formed on the 4th and 6th of February in 2020, after a meeting that we had in Kampala, Uganda, which was graciously hosted by Kasiria Rogers, who is the Vice President of the WFAD, the WFAD, World Federation Against Drugs. And it was agreed, and it was seen that there was necessity for the different civil societies, organizations that are working in the field of prevention and treatment, to form a network which would spearhead the work and the interventions, because being in the region, we have similar situations, similar challenges, and we felt like if we can combine our efforts in terms of our different approaches and what works, and with the standard that we can use to help our communities, would be better than just working individually. And the fact that the East African community is becoming more integrated, so we felt also our integration as a civil society would be very key, also in raising our voices. Sorry for whoever, some noises there. They need to work together as organizations with our governments to promote a safe and healthy environment for promotion of drug demand reduction, prevention, treatment, recovery, and aftercare programs. And the countries in question here include Tanzania, Uganda, Burundi, and Kenya, which participated in the Kampala meeting together with WFAD and other partners from across the region, even in Europe. And later on, we have also involved Rwanda, Ethiopia, South Sudan, and also other nations within the East African region, Eritrea, Djibouti, and Somali. We hope to bring them in because we are in the same localities and face the same challenges. So we also recognize that drugs and issues of drugs and crime also encompass related issues, including gender-based violence, crime, and one of the other really upcoming issue of transnational organized crime. So after the workshop that we had in May in Nairobi here, this was an issue that came out especially from the presentation from the DRC, and we are so glad that today we have one of the presenters from DRC, Emmanuel, who will give a highlight of the situation as it is. This issue actually was even raised during the CND forum in Austria, in Vienna this year, and it was even recognized by the UNODC. So we are so glad that we can have different presenters today just to give a highlight of what has been happening within the East African network, and just presentations about WFAD and the platform and the opportunities that are there within the WFAD, because we credit so much for enabling this network to be strong it has really been supportive of the organizations within the African region. So basically, that is a background of the East African Network. We have individual and organizational membership, but mostly we advocate, we encourage mostly organizations because those are more formalized and more recognized by the governments, regional governments. And we always, I encourage that we join as organizations. I need also to mention that we have a chair, George Ochieng. He's been the chair since its inception in 2020. And he's from Kenya, George Odalo. Many of us are familiar with him. And we have a secretary, Ruth Kome, and she's from Uganda. So in a nutshell, the network has been very vibrant. We have had, I would say, about three other workshops or sessions that we met physically. Two of them in Nairobi, the other one, of course, in Kampala. And we are still trying and seeing, working hard to see how we can have this in-person meetings in all the countries around Tanzania, Uganda, Burundi, just when the available resources are available for this to be actualized. So we shall maybe have another brief period after the presentations that we can also just highlight or give questions or any give comments or any questions that may arise. But for now, I wanted us just to go straight into the presenters and the presentations who have graced our occasion today. And I believe that we are going to really learn a lot and get some insights into some of these, into what we've been doing and what exactly our country situations are like, especially from DRC, because it's one of the newest members in this network. So without further ado, I want to give the floor to Emmanuel and Shokano from Bukavu in Eastern DRC. And Emmanuel is a former he's a confessed former drug user who's in recovery for 15 years, has been sober for the last 15 years. And he is the coordinator of an organization called OPADEC. I'm sure he just mentioned what it is. It's in French, but it's mostly, it promotes agro-pastoral development in Congo. And they work mostly to promote entrepreneurship among the young people. And it was formed in 2019. And they have a program called Congo or DRC Without Drugs, which has interventions in prevention, rehabilitation, harm reduction, and social economic reintegration. So he will give us an insight into some of the realities in DRC. This is partly what he did when he graced our workshop here in Nairobi, and it was really a learning time for many of us. We only know DRC from a conflict level that has many minerals, but sometimes we don't know the insights of the reality on the ground. So I will leave Emmanuel just to give a presentation on that. And I believe all of us will be really, our eyes will be open to how the situation is in DRC in relation to the East African network. So Emmanuel, if you're there kindly, the floor is yours.
Thanks, Paul. Good afternoon to everyone. Paul said, I'm Emmanuel Kanyuri from DRC Congo, and I'm the coordinator of OPADEC, but especially we are concerned here by the Congo Nation Sans Drogue program. Now let us begin about Congo situation now. The Democratic Republic of Congo is one of the Central Africa countries most affected by war and armed conflict. This has cost life to more than 8 million people and forced 7 million to displace, searching for more secured place to live in or out of outside the country. Why this situation is imposed to us? The answer is also very simple. In our day, enterprises governments or states need a raw material for the manufacturing of final products to sell to local, national, or international markets. And this raw material must be found in on a very cheap price for them to make a big profit. Among these, we can list minerals such as coltan for the manufacturing of mobile phone. We can list also lithium and cobalt for the manufacturing of batteries to use in electrical cars, but also gold, diamonds, silver, and whatever that we use in jewelry industry. Unfortunately, all these minerals are available in Congo, and for to have the license of exploitation, enterprises must sign a contract with the government. But for them, the process is long and the profit to make will not be big. Now, most of the time, they decide to use organized crime by creating a group that they support with guns in order to chase people where minerals are located for to facilitate exploitation. When they are chasing people, they kill some of them, they rape women and girls. They do also trafficking of some rare animal like okapi and mountain gorilla. They kill also elephants to have ivory, but also they do trafficking of guns and drug. That's the reason for to obtain gun or all kinds of drugs like heroin, cocaine, or crack has become very easy than in other countries in Africa. Now, when people are forced to go away from their place, at the place of where they go for displacement, they are facing many challenges. They are living now there in a vulnerable situation. They lack of everything, no food, no medical care, no peace. Now, this situation affects now more youth. And to escape this situation, more of them turn to the use of drug abuse, and this make their tag. Now, many of them, after a period of time, they develop addiction. And unfortunately, in the country, there is any rehabilitation center. Imagine for a country with 100,000 million of people facing many challenges like war conflicts, but there is any rehabilitation center. These youth and other people now are facing many challenges. They are suffering also from many diseases like HIV, TB. Some of them also are dying with overdose. But this situation is also the cause of many many situations or phenomena like juvenile prostitution, like crime, like the situation of many as other situation. Let's understand that this is a need, and it's time for everyone to involve in this situation. The international community, NGOs, UN agencies, to do something now because tomorrow may be late. Now, what we are doing on the ground as NGO, we are working in prevention, and the prevention program is focused in many groups. And for now, we are doing prevention in workplaces, schools, in the entire community, but also sometimes in public places. For the school, we have a program called École Sans Drogue, School Without Drug. It's a program that we organize, in which we organize 4 sessions every month. For all other programs, we are collaborating with media to spread the message everywhere. We are also working in harm reduction. And in harm reduction, we are focusing on drug user. In this program, we provide them with social needs like medical care, food program, but also we train them in social reproductive training, and we advocate also for their rights, because sometimes we organize workshop with drug users and police official, in order to understand together the addiction and how they can behave in every situation, and to understand that the place of users is not in jail, but in a holistic program. That's only the way we can help them. For the rehabilitation, until now, we don't have any rehabilitation center in the country. For the moment, we are collaborating with our partner located in Rwanda called Isange Rehabilitation Center. For those who want to have rehabilitation, we send them there, and we ensure now pre-rehab, rehab, and after rehab. And we are doing also family reconciliation, but also we are doing social economical integration. And in the social economical integration, we are training youth in some life skills like sustainable agriculture, carpentry, sewing, arts, and other many. For the networking, we are member of the East Africa Network, and last time we have participated in the conference organized in Nairobi on the topics of uniting prevention and treatment. But also we have participated in the UN Civil Society Conference in Nairobi in May. And in this conference, we have participated also in the parallel meeting workshop organized by the UNODC and Vienna NGOs. I remember that this time I've talked more with COSIR about how French speaker countries can also benefit for some program in prevention, harm reduction, and also rehabilitation. Now, what we are needing now, the need we have is the rehabilitation center first here, but also a harm reduction center to help many people who are using drugs, especially heroin. But also we need to have a center where we can have youth and to inform them about drug abuse, but also empower them
Looks like we lost Emmanuel.
Yeah, I'm afraid
Is that
he
so,
he lost his connection.
Yeah,
He's
just
popping
seems
back
to have-
on now.
All right, maybe you can just admit him and then, because I think he was almost finishing now.
Yeah, Emmanuel, can you hear us? No.
Okay. So just maybe some few seconds and then see if it possible. Is he in the waiting room, Bram?
I see he's part of the participants, but he keeps on popping out and in, so it seems like there's a bit of a connectivity problem.
Okay. All right, so let me kind of just be summing up, just in case he comes and he wants to finish up, he can do that. Maybe he can, could be given a minute just to wind up. But I believe all of us, are a bit now familiar with some of the situation, the complex situation that is in the DRC. And like Emmanuel has really, presented on the use or the situation of drugs in the DRC and the correlation of drug use, trafficking, gender and sexual violence, local and transnational organized crime. I mean, this is a whole package within the DRC setup, and especially in the east side, because that's where most of the conflicts are always rising in the DRC. So I believe is a community, or it's a place that needs a lot of attention. And this is why actually the network was formed, so that we can highlight, we can voice some of these situations that otherwise were more silent and could be not be known the national or the international platform. So we really thank Emmanuel and all the organizations in DRC who are really trying the minimum resources and available at their disposal. I've been to the place itself myself, and really you can see that they are doing the most they can with the little that they can. So we believe that somehow good days will come ahead through this kind of collaboration and engagement, and through this network. So thank you so much, WFAD, as well, for the support you've given to such organizations to bring them into the light, and even for their issues even to be felt as far as the UNODC headquarters. So I think without further ado, I would want to welcome our next presenter, and this is none other than Lilian Gitau. She's from right here in Kenya, in Kisumu. Kisumu is the western side of Kenya towards Uganda. It's the last city before crossing the Uganda border. And Lillian is in charge in treatment of the Renaissance Treatment and Rehabilitation Center. She has she's internationally certified addiction professional from the Colombo Plan. And she is a counseling psychologist currently studying for a master's in psychology at the Great Lakes Region University in Kisumu. And she's also the chairperson of the Kisumu County Community Work Group on Drug Use and Prevention and Response. This is a collaboration between the government and the civil society working in different regions of Kenya. So in that region of Kisumu, she is the chairperson. And I believe she got this opportunity or this, this position just around this year when we are having the Connecting the Parallels Forum in that region. And so we are very proud that it really connected well, and she was recognized as being a pioneer of both treatment and prevention. So Lillian will give us a professional highlight of the approach in connecting prevention and treatment, just from even a very basic level, that people who are in prevention can have a basic idea of what treatment is about. And those in treatment cannot just confine themselves to a silo that is called treatment, but also how they can be engaged in prevention interventions as well. So Lillian, I say karibu sana, the floor is yours.
Thank you very much, and I hope all of you are okay. Am I audible enough?
Yes.
Very
If I'm
sharp.
audible, please wave at me. Wave at me. Those who are not
Okay.
waving, you can wave at me in your hearts. Thank you very much. I appreciate. Like Paul has introduced me very nicely, I'm Getao Lillian, and I'm a professional in treatment. What I did not mention earlier is I also work with women who use drugs in the area of prevention and harm reduction. And so on the chat box, for those who can access it, I have written the objectives of my presentation. The objectives are there. I am going to be discussing basically which are the parallels we are discussing in this case, so that I can get the context clear. I'll also tell us what is happening in Kisumu, what are the challenges, what are the opportunities, and then we can have questions in case I need to explain any more than that. Okay. Now, quickly, what are the parallels? In where we are, we have parallels on prevention. Prevention is done through school-based interventions, out of school-based prevention, positive parenting, workplace interventions. Those are the interventions that are happening, at least I know, in Kisumu. And I also mentioned the partners that are working in Kisumu as I finished. And then in the area of treatment, we have the early intervention, where we have a screening, brief intervention, referral for treatment. That is called SBRT, is an evidence-based practice. And that is done in the community, and it's intersection between, it's in the community largely, that also has a referral to wherever it is that needs to be taken. Then we have outpatient, intensive outpatient, then we have intensive outpatient and partial hospitalization treatment. We have rehab residential, that is inpatient treatment. That is also medically managed intensive inpatient treatment. And between intensive outpatient, we also have methadone assisted treatment, that is for opioids. And that is what is happening in one parallel. And then, of course, there is aftercare, which is another parallel. Now, so the next objective, what's happening? Why are we in parallels? Why would parallels become comfortable? And that would form the source of our discussion. The resource constraint issues, like if you are donor funded, you're donor funded within a certain area, and largely prevention. So prevention is funded in a way that you only do prevention and refer elsewhere for treatment. And the objectives, the indicators are very clear: just do prevention. So when you have resource constraint, you're already tied to just prevention. And then we have vested interests. A vested interest is where your interest does not include the whole continuum of care. If the interest does not take care of you at the prevention level through the continuum of care to aftercare, it becomes difficult to break down the silos. Now, there's also largely lack of proper understanding of points of linkage. Where does prevention and treatment intertwine? Where does it come together, or where can it come together? Then there's not very good understanding of the benefits of connecting, the why. There's the issue of the how, there's the issue of the why. Why would we connect? What are the indicators? What are the best practices that have brought us results from breaking the silos or connecting? And there's also the policy situation. As we are, issues mental health are domiciled in the Ministry of Health, mental health, and issues substance use disorder are domiciled in the Department of Trade. And meaning treatment, which is largely could be a medical issue, is in the trade. So treatment is left wondering what to do with itself, because it's a medical problem that is in the trade. And so that kind of policy situation pulls up some murky waters, making people not able to go that direction of breaking the silos. In Kenya, we have treatment around 90% private practice. I am in private practice. Even as I discuss issues of breaking the silos, I'm a private practitioner. I run a rehab center that people pay to come to. So I don't do it for free. But how many people can afford to come to my practice? And I work in an area where the community is in dire need, they can't pay. So on humanitarian grounds, I tend to work with people who are struggling and yet cannot pay. That makes it imperative that I work within the confines of prevention too. Then, so what is happening in Kisumu? What is happening in Kisumu? We had the program on the silos, the connecting the parallels sometime last year. And there was an awakening of why we should come together. And Kisumu is uniquely placed because before then, we have had a technical working group that was brought together by a few people, and we've been able to do events together. But still, it becomes an events-based kind of network. We do one event called International Day Against Drug Abuse. We do it beautifully because we come together. But on the ground, we are not yet together as we should be. And there is still so much work to be done. The national government, NACADA, has been able to put together a community work group that puts together community groups to work together. But still, there is need for cohesion because of lack of resources, especially. Some of the groups are faith-based, so they have vested interest. Their main objective is largely to preach. So in absence of resources, the prevention not work as well. So we have an opportunity to come together and leverage on each other's resources. And what has come through in the last 1 or so years is that working together is the only way out. What are the opportunities? When you have prevention, it gets to a point where people are already using. We cannot do prevention anymore, but they're not sick yet. So we can do prevention from start of use. Do not start using. Do not use to a point of sickness. And when you get sick, you can do harm reduction, after which, if somebody is unwell, they go for treatment for SUDs, and we have relapse prevention, which also is a prevention aspect. So there is a whole continuum of care where we have opportunity to either do treatment or prevention. However, the idea is not as well bought as it should be, because there's really those two things, the why and the how. So Paul, back to you, I think, up to there, and there are questions. Thank you.
Thank you so much, Lillian. It just felt like you cut off midpoint, but I think the whole point has gone home. And let's say just for now, we can hold our questions until after the sessions, because so that we don't eat into the time of the presenters. So I can also already see that Rogers, your hand is up, but I just request that we hold our peace for now until all the presenters, because maybe Mate or Cressida may be having some other engagements after this, and we just need to finish up with the presentation. So just hold your questions, but I want to appreciate so much Lillian. I know that, Lillian is very, might be brief, but already the point goes home. When we had this workshop in Nairobi, and also in Kisumu, we had it in Kisumu last year, should be in September, October, and then we had it in Nairobi, the one that brought the East African group. And she came out as a very resourceful person that even many organizations could tap into her experience, her passion, very professional, technical, but at the same time very humanistic. And as you've heard, that even what organization she's running and the programs in Kisumu, which is one of the low-end regions of Kenya, but she's been able to build such a niche, and the communities there really appreciate for the work that she's done, prevention as well as treatment, all the way in that continuum of care. So we really appreciate for your input, Lillian. I know you are very much more used to in person, because you love to go to the person and speak to them directly, and I believe that's part of your profession. So, but I believe that the point has gone home. The linkage, the clear linkage between prevention and treatment, and how that this needs to be, I would say, interactive, to be engaged, to not work separately, but really to work together for the realization of a holistic outcome of the intervention. So I think you have triggered one or two questions, I believe. So at the end of the session, expect some feedback from the group. And thank you so much for that. I don't know if Emmanuel was back. We had said we'd give him a minute just to summarize. We don't want to be unfair and just cut him off, but I don't see him. Do you see him?
I don't see him either.
All right. So I think the fair thing to do is to go right to the next presenter, and that's Cressida. You don't have to mute because you are the next in line. And yeah, Cressida is across. She's from across the Mediterranean, across the ocean, based in Sweden, originally from Netherlands. But we call her one of us. It's only that she chose to be away from us for some time because she's been with us in these programs and the projects in Africa here, the DRC project, the Connecting the Parallels project. She's just a household name here in Africa, and especially in East Africa. So we are so glad to have you, Cressida. And apart from just being our sister in this kind of intervention, she's also the project coordinator and communications manager at the World Federation Against Drugs. And in her role, she coordinates international development projects and is part of the Global Gender Committee. She organizes international conferences and webinars, and actually, like, this is a manifest of her, her career in that, and is a point of contact for members, a co-writer of various preliminary studies and position papers. So those who have interacted with Cressida can bear witness that this is nothing but the truth. And therefore, Cressida is going to give a highlight of the WFAD and present just maybe a little bit more of what Lillian has spoken on the cycle of prevention, recovery, and the continuum of care, possibly mentioning some of the defined models which have had evidence on the local and international level. So Cressida, Madam, the platform is yours.
Thank you so much. Such a warm introduction. So almost makes me shy. But I'll get back at it. I'm very much happy to be here and also to be online together with all of you. I think we have collaborated quite a lot in the past already, and I'm very much looking forward to more in the future. And definitely, I would love to be more close, rather not only through the online screen, but also to pay a visit one day. And it's still on my list to do, so hopefully. And on another note, it's very difficult to follow up Lilian, because she's given a great insight of the continuum of care already, also from a very practical experience. And me, I just will follow up a little bit and elaborate on it, what she said basically, and maybe go a bit more theoretical, but also showcase some examples. And to kind of showcase what the continuum of care is and how we can ensure that we strengthen it by connecting all the parallels. So I can basically confidently say that all of us are working within the continuum of care, all of you that are online, and also doing everyday work in all fields. But what is it exactly, and how can we work towards building a strong continuum of care, covering all necessary aspects while connecting the parallels? So the continuum of care highlights the importance of collaboration between prevention and treatment, as well as recovery and relapse prevention, as Lilian pointed out. It is a comprehensive approach that encompasses prevention, including early detection and prevention, as well as which includes to even pregnant mothers, to kind of start prevention with them, all the way to treatment, recovery, and reintegration and prevention of relapse. And a continuum of care entails first and foremost that our governments are committed to not only to the UN Conventions on Narcotic Drugs and the SDG 3.5 to strengthen prevention and treatment, but also to that of the Convention on Rights of the Child, which holds governments accountable to protect and prevent children and youth from engaging in use, trafficking, or dealing of drugs. However, in reality, we know that even our governments lack resources and possibilities for actions and integrated services. And it is here that we as civil society has an important role to play, not only in the collaboration between different sectors and stakeholders, including the government officials, other civil society organizations and service providers, but also in highlighting evidence-based and best practices, while showcasing and championing the voices of people in recovery. And our job as civil society is to ensure that the continuum of care stretches from prevention through services, finally reaching long-term and sustained recovery for people who are struggling with substance use disorder. And I will go through each topic individually. So starting with prevention, no matter the country or place, prevention is of utmost importance, but in particular contexts, that lack of social infrastructure, struggle with poverty, corruption, and lack of opportunities, prevention is even so much more essential. And why is it essential? As most of you know, it's not that costly. It is also very accessible. And reports show that for every dollar spent on prevention, at least $10 can be saved in future health, crime, and social costs, which some reports even go up to 300 and 400 dollars of savings. Prevention also has a mediating factor, as it does not only focus on substance abuse, but while strengthening protective factors, it also prevents other risky behaviors as well, while also increasing mental health, ensuring school achievements, reduction in violent behavior, changing attitudes, and developing social skills. And recently, the UNODC has published the international standards. It's already a few years, but it's a very good and valuable tool, and has actually been considered a paradigm shift of prevention, what works depending on the age group. And it also shares existing evidence, including gender sensitive and age appropriate measures. As I said, it's a valuable tool in helping us to revisit the strengths and risk factors. Besides allowing us to understand what works and what doesn't, it helps us emphasizing on particular areas depending on the age group that we are targeting with our prevention efforts. And it's a summary on what, and it's evidence-based, as I said, and based on science. We have seen an increase of funds in some parts of the world towards necessary services within the continuum of care, such as harm reduction and treatment. However, prevention funding is still lacking, and most likely due it to be needing long term. It's rather short, like it's a long term investment, I would say. I'll go to next slide, sorry. So it has been, people have become more aware of prevention. So like more and more efforts has been shown in prevention. However, there's still a lack of funds due to, as I said, the long-term nature of it. And it doesn't show quick results, which are often required for policymakers and politicians for to push their budgets. And they're more likely to spending on treatment, which show a direct result. And also we lack research and evidence that goes beyond the West, and as well as culturally sensitive training and tools. However, despite these challenges faced by probably yourself as well and all of us, prevention has been put on the agenda, as I said, through this advocacy of civil society, with a very good example being the Oviedo Declaration, which was launched at the most recent Commission on Narcotic Drugs in March this year, and it has over 2,000 organizations around the world that endorsed the declaration. And they will continue the momentum by raising more awareness with it. And also the work done by yourself with little and no resources. Another good example, which was also already mentioned by Lilian, is NACADA, which basically establishes a collaboration between government and civil society as they work alongside and together with civil society ensure to present updated data, support NGOs with evidence-based prevention and treatment guidelines for people in different contexts and ages. And it's also important to know that while providing our work in prevention to strengthen the work of our work, we need to be able to follow developments. Because without knowing of where we are locally, regionally, and nationally, it is hard to know which political decisions or services are the right one. And therefore, we need to map, monitor, and evaluate, and need to be flexible and have localized data from which we base our prevention activities on. And we need family-based approaches, community-led engagement, and community ownership, and child-centered intervention and a strength-based approach, incorporating young people themselves in activities, including young people in schools and playgrounds, communities, and homes. And while strengthening prevention and advocating for prevention, we must also address the benefits in the context of low and limited resource settings and work with stakeholders to influence policies. We kind of need to always showcase to the policymakers who always think about quick results and low budgets, that this is indeed a low budget input or effort. It just requires, it only showcases long-term results. The next is within the continuum of care is treatment, harm reduction as well as treatment. So as the graph shows, there is a need for the provision of treatment, even though prevention remains incredibly important. There are some people that unfortunately end up being dependent on substances and would require treatment as well. And the most recent World Drug Report showcases that in 2022, globally 64 million people were suffering from a drug use disorder, which is an increase of 3% over the last 5 years. However, only 1 in 11 do receive the treatment they need, and this number is significantly lower than the numbers presented by the World Drug Report in previous years, where it was estimated that 1 in 5 people receive treatment. However, the number is even lower among women, where an average of 1 in 18 receive treatment. So barriers in accessing treatment are multiple, but women are most affected. In addition to the family expectations and responsibilities that they face, women may experience further barriers in accessing treatment that include increased fear of legal sanctions, increased social stigma, lack of childcare, and fear of losing custody of children while they are in treatment. And women who use drugs are also members of certain population groups, for example, trauma and violence survivors, people with comorbidities, sex workers, prisoners, or members of ethnic minorities face more severe vulnerabilities, include higher levels of stigma and discrimination. drug use disorder can be treated effectively. In most cases, if people have access to a wide range of services that cover the spectrum of issues that individual patients may face, and treatment services and interventions must be based on scientific evidence and match the specific needs of the individual patients at a particular phase of severity of their disorder. Sorry, I just hear someone else talking through me. These services should be affordable, attractive, available in both urban and rural settings, and accessible with a wide range of opening hours and minimal waiting time. And there's a need to minimize all barriers that limit access to appropriate treatment services, and also services should not only offer treatments for substance use disorders per se, but also provide social support, protection, as well as general medical care. And a legal framework should not discourage from attending treatment, but it's necessary to ensure that treatment environment is friendly, cultural sensitive, and focus on the specific clinical needs and level of preparedness of each person, which encourages rather than deters individuals from attending. And within the continuum of care, we move on to the next step, basically, is recovery, which I want to shed a light on as well, as it is an essential element. Recovery has been defined differently around the world and in different research. However, some definitions include are included on the slide. And the recently launched global position paper on recovery, which was launched also at this year's Commission on Narcotic Drugs in Vienna in March, and is endorsed by 150 organizations and 345 recovery allies around the world, reached a global consensus around the goals and the meaning of recovery. And it was conceptualized in 3 pillars. First is strength, the second is the barriers, and the 3 is the systems needed to optimize the positive effects of strength on individuals and communities while simultaneously reducing barriers. We should remember one thing is that people can and do recover through dedicated services and peer support. But what does enable recovery change is kind of summarized. Of course, it's always a bit difficult to summarize, but it is summarized in an acronym presented by Professor David Best, who showcases the holistic approach towards recovery in which connectedness, hope, identity, meaning, and empowerment are essential and interlinked. And by ensuring that these five elements are supported, recovery capital is strengthened and recovery is enabled. And recovery capital, as you can see on the slide as well, entails of personal capital, social capital, and community capital. So to conclude, to ensure that the continuum of care is strengthened, connections between prevention, treatment, as well as recovery need to be established. To do so, it demands a holistic approach and a cooperation between civil society and public institutions alike. We need to ensure sustainable and long-term efforts that stretches from prevention to recovery, as well as prevention of relapse, so aftercare. Some of the steps need to be included as early intervention, in which prevention programs can identify individuals at risk of developing substance use disorders and intervene early. This early intervention is vital for preventing the progression of addiction and reducing the need for intensive treatment. Also, community engagement, in which collaboration fosters community involvement and support. Communities can actively participate in both prevention and treatment efforts, creating a network of care and resources. The third one is reducing stigma. And by working together, prevention and treatment specialists can collectively reduce the stigma associated with addiction, which can encourage individuals to seek help before their substance use problems become severe. A continuum of care, in which collaboration ensures a continuum of care where individuals can seamlessly transition from prevention programs to treatment services when needed. And this reduces disruptions in care and improves overall outcomes. Also, policy development is important to collaborate in order to develop comprehensive substance use disorder policies that encompass prevention, treatment, and recovery. These policies can guide government agencies and organizations in their efforts to combat addiction. And as has been mentioned before, and as I will mention it again, the collaboration between all of these aspects is crucial for preventing the development of addiction, reducing its impact on individuals and communities, and providing comprehensive care that addresses this physical, psychological, and social aspects of the complex issue. And the collaborative approach can lead to more successful outcomes and a healthier society. And since, as Linia said, we are often very much bounded or by our own resources, which are connected to a particular project or implementation or service, it's best to collaborate so we can cover the continuum of care together and make sure that it is holistically, the holistic circle, I would always call it, is basically strengthened. Okay, thank you very much.
Thank you. Thank you so much, Cressida, for that very brief but very comprehensive and insightful presentation. And as we said before, that WFAD, where Cressida is based, has been very essential in voicing the situation of the marginalized groups, especially from Africa. Many of us are beneficiaries of engaging at the international platform, courtesy of the World Federation Against Drugs. So it's been very essential in connecting the local communities to the international forum, as well as bringing the professional standards and evidence-based approaches from the international situation to our local level. So it's important, and possibly for those who may not be members of WFAD, you are encouraged to do that. You can always get Cressida's contacts and also WFAD. And so we appreciate you so much, Cressida, for making that time and that presentation. I believe that we are more professional now than we were before the session began. Thank you so much. I want to finally give the floor, lastly but not leastly, I would say, to the big man of the forum, of the workshop. Big not in terms of size or maybe position, but just in terms of his great efforts in terms of promoting best practices in prevention and his contribution then on the international level on someone shows okay, fine. Yeah, his contribution is immense on the local and international levels. He's none else but than Matej Kosir. I don't know if we pronounce that very well. Matej Kosir. Yeah, and he was actually here. Was it in May or April during the? He was in Nairobi during the UN conference. And we were very glad to have him. We attended the sessions and we gave our contributions. And we are very honored that you could be with us in Africa. And he's the director of the Institute for Research and Development, UTRIP, and he's been working in prevention and advocacy in the field of alcohol, tobacco, and other drugs for around 25 years. He is a professor, PhD, candidate in preventive sciences at the University of Zagreb, Croatia. Wow, this workshop is really diverse. We are so glad. And he's the president of the International Confederation of Research Associations in the field of alcohol, tobacco, and other drugs, that is ICARA. And the chairperson for us, especially, this is important, the chairperson of the Vienna NGO Committee on Drugs. And he was voted into that position last year, I believe. And again, was confirmed this year that there was no one who could match his expertise and his passion. And we are so glad to be with you this evening, Matej. And the floor is yours to give us a presentation. Thank you.
Yeah, first, thank you very much for great presentation and introduction and invitation to this meeting. I'm always honored to be invited to discuss with different members of Vienna NGOC, and also friends and colleagues from all around the world, and especially in Africa, because you mentioned already the UN conference. we really were able to collaborate to discuss many different issues, and not just from the perspective of prevention and treatment or recovery field, but also cross-cutting issues, cross-continuum of care topics. So it was important for us to initiate also Impact Coalition, which was established in Nairobi this year. And I will maybe talk about this initiative a little bit later. So yeah, as I was invited to be present here as chair of Vienna NGOC, and this is the role I'm speaking today. So I will not focus on one particular field, like I like to speak about prevention a lot, but I will try to speak from the perspective of the continuum of care, from integrated services, which I think it's important for us, not just for civil society, but also for the national authorities, and especially for any initiatives which bring together different stakeholders like authorities and civil society organizations together around the same table. And for those who are not very familiar with Vienna NGOC, it's a global platform which provides a link between civil society organizations and Vienna-based agencies involved in drug policies, such as UN Commission on Narcotic Drugs, International Narcotics Control Board, and especially United Nations Office on Drugs and Crime, UNODC. So those three UN agencies, Vienna-based agencies, are the most important agencies which we try to provide link and connection between civil society organizations from all continents and them in Vienna, and also at some other events such it was the one in Nairobi in May this year. And besides that, we also promote collaboration. We support different NGOs to collaborate together. No matter of the area of work, we try to encourage civil society organizations to come together, to discuss together. And we are very glad to be part of these discussions like it is a discussion today. We also try to enhance communication. We promote activities that lead to enhanced communication, cooperation, and scientific, cultural, and social exchanges between NGOs, UN agencies, member states, and also academia. In the last couple of years as well, we try to be more involved with academia as well. And of course, as you can imagine, as an international platform of civil society organizations in the field of drug policy, we try to ensure balanced representation as well, so that the whole continuum of care is represented in an equal and balanced way at the different events and different communication with UN agencies, and also between civil society organizations and authorities, member states as well. So just a couple of key numbers. We have now 418 members, member organizations from 106 countries. So we are expanding slowly. And one of my objectives, my goals as chair of Vienna NGOC is to reach 500 members before I finish with my main mandate, or as I can say now already, before I finish the first mandate, because I'm planning to run for the second mandate in March next year. So before I finish with the first mandate, we hope that we can have more than 500 members. And it's very nice also to say, to mention that a lot of new members which are coming to Vienna NGOC are from prevention and recovery field as well. So we are very happy to welcome all organizations. And I think also we are extending membership in African continent as well. And that's also thanks to the establishment of African Civil Society Forum on Drugs, also not a lot time ago. And this Civil Society Forum on Drugs is also getting a momentum and trying to map all civil society organizations in African continent which work in the field of drug policy, and also invite them to be involved in activities of Vienna NGOC. For those who are still not members, you're more than welcome to become. You can simply go to the website of Vienna NGOC and search for this information, which is published on this slide as well. And I will share these slides with Cressida as well. So all participants of this webinar will get this presentation as well. So it's not necessary to make a photos or to write things from this slide. Just the basic information, the instructions how to become member. And it's not very difficult. And as soon as you are on the table of Vienna NGOC board, and if you are connected with the drug topics and fulfill all the very simple criteria, you can quite easily become a member of Vienna NGOC. Of course, we ask also members to pay the membership fee. But honestly speaking, I think it's not a lot, and it's very useful and valuable for Vienna NGOC, so we can organize as many activities as possible, not just in Vienna, but also in other conferences like UN conference in Nairobi this year. We are also able to use our membership fees to organize some specific activities and events. There are several achievements already by Vienna NGOC on the historic line, but I will not go deeper in all of them. But it just means that in every crucial moment, global drug policy, civil society was engaged and involved in discussions with UN agencies and also with member states. And I think we are getting also bigger momentum in the last couple of years. So we are getting even more involved in particular important political discussions in the field of drug policy. So the last one, which I want to mention, is the 2024 midterm review, where civil society was very, very engaged, not just with preparing and organizing regional consultations and the global consultation with the survey, but also, and not also with the report, but also we increased number of speakers from civil society at thematic discussions and different other events. So we are trying to improve all the time the engagement of civil society at the global level, as balanced as possible by gender, by regions, and also by area of work. About some current opportunities for civil society organizations to be involved, I already mentioned Impact Coalition, which was published at the UN conference in Nairobi. And the main purpose is to connect better civil society organizations with other stakeholders, such as member states, academia, UN agencies, etc. So the purpose of action plan of Impact Coalition is to bring current and future initiatives which could bring civil society together with other stakeholders, especially with member states and UN agencies. So whatever you see already the current existing initiatives, like one was mentioned already from NACADA and the system of collaboration with the civil society organizations. This is a very good example, and we can say that NACADA is very proud co-sponsor of Impact Coalition already, and will be also co-sponsor of our side event at the Summit of the Future in New York in September. So we collaborate very well with NACADA, and we are now in connection also with the Kenyan government, so they can join us as well. So we are searching particularly for that kind of initiatives which bring together in very effective and sustainable way civil society organizations, member states, and UN agencies together around the same table. And there are also some other opportunities, like every year at CND, and that's something I would like to highlight here. Many people are very happy about the increasing numbers of side events. I am not among them, because I would rather see that NGOs connect to each other and organize joint side events with some, focusing on cross-cutting issues. Because if we have, 100 more prevention side events or 100 more harm reduction side events, I think we are not going to the right direction to promote collaboration between civil society organizations. So our goal for the next CND is and will be, and please try to take this into consideration, maybe to decrease a little bit the number of events, but bring different kind of organizations together with the cross-cutting issues to discuss and present good examples of collaboration, and not just between civil society organizations or among civil society organizations, but between CSOs and member states and UN agencies. We will definitely promote and encourage civil society organizations to think in this direction. And also, we would like to already start promoting some other engagement, like in informal dialogues, especially with some UN agencies. There is a huge lack of questions or comments, contributions from prevention and recovery side. So we would also like to encourage that we bring a balanced interventions also in informal dialogues with different UN agencies. Like also we tried as a Vienna NGOC board, we tried to bring as many civil society representatives to some other events as well, like INCB Civil Society hearing. There will be a lot of opportunities to be engaged in CND intersessionals this autumn as well. Especially this year, the focus will be supply reduction challenges. But I think also prevention and treatment and recovery organizations have a lot to say in this supply reduction challenges. It's not only police, law enforcement, and maybe some drug policy focused NGOs which are relevant for this kind of discussion, but also from other areas of continuum of care, such as prevention, harm reduction, treatment, and recovery as well, and access to essential medicines too. We try to organize as many webinars as well. There will be a lot of webinars, before the before the thematic discussions and next CND. So we'll try to engage as many stakeholders as possible to discuss with civil society organizations, to listen to us, and also to provide some answers and relevant information to us. Also, it's worth to mention as well that there is also a marketplace. You can simply go to the website of Vienna NGOC and you can find a link to the marketplace, or just directly go to the marketplace website. You have it on the slide. And this platform, online platform, is supposed to offer civil society organizations and members of the NGOC a platform to exchange, to engage with each other, to search for partnerships, to see which organizations do similar things, to avoid maybe some duplication, and so bringing those organizations together so they can really start working better together. Sometimes even in the same country, they don't know each other, and it's then a good tool, a good platform. They can search for members in their own countries as well. And this is the board, the current board. I think there are several members from prevention and recovery field. So if you think you have an idea or a question or some proposal, you can always come to us. and we will definitely put this on our agenda and discuss about your proposals and suggestions and ideas how to even improve engagement of civil society in at the global level, but also at the African continent. And we can easily use now infrastructure we have established based on previous work of African Working Group. Now we have African Civil Society Forum on Drugs. A lot of you, I saw, or some of you are already members of this forum. But others can join as well, especially if you want to be engaged in different activities. It's mostly on voluntary basis, and this is a very good infrastructure for you in Africa to be involved with and deal with very context and cultural oriented issues and challenges you have in the African continent. So if you want to get in touch with us, here you have some key contact information, and you can also follow us on social media. If you want, we pretty much publish and post everything what is relevant for civil society organizations in social media as well, not only on the website. So it's also valuable and useful to follow us on social media. So this was very short presentation how civil society organizations, especially from your continent or from East Africa specifically, can be engaged with UN system in the field of drug policy, and us as a Vienna NGOC as well as a global civil society platform. Thank you very much.
Wow, thank you. Thank you very much, Mate. As mentioned, really, he's a very resourceful person. Because many of us really try to see how we can get connected at the UN and try to just directly go through the UN connection. But this is an easier way, not an easier, but a better way of then accessing the UN through the VNGOC. Many of us, again, have been beneficiaries of collaborating with the UN through the VNGOC. And it's a very simple, platform to get into. It doesn't have many complications, doesn't have many technical issues, and they take care of, as Mate said, of everybody, regardless of their region, regardless of what they are doing, as long as it's something connected to issues of drugs. So we are so grateful, Mate. We know you are being here for 2 hours. It's really a sacrifice on your side. And we just want to really recognize for your input in this forum. And I hope that all participants who are here can take advantage of that so that we don't have questions. How does this one is able to get to the UN and I'm not able? This is the simple, gateway to getting into some of these international platforms, the networks, and the opportunities that are there, which Mate has mentioned. Really, he should have had an hour plus just to give presentation of this, but he tried just to be brief because of the benefit of time. But I hope that if we have this kind of another forum, I believe that Mate, you can kindly consider joining us again because we really want, especially from the African region, to be very well enlightened, to be aware of what is happening and how we can be engaged. So thank you very much. And back to Cressida. We thought that 1.5 hours would be really long time, but it has really flown. We are already past. But I think we can just, for those who may have some comments and questions, if we can just extend for a short while. Cressida.
Yes, no, I believe we can have a 5 minutes addition of questions. So because I already see one here hand raised, and I know before there was another hand raised. So by Roger, so I don't know if he's still here, but first maybe Ngozi Uzama, if you would like to pose your question, welcome. Thank you.
Yeah. Hello. I know the time is very short. Please, is for the last speaker, Mate. Do you also accept individual people, and people like victims victims of, because myself, I see myself as a victim, but on the other side now, I'm a PhD candidate from the University of Nigeria, Nsukka, and my area of specialty is influence of EU policy on migration in Africa, but I used to be a user or an addict or whatever you call it. So I see myself as a victim. So do you have also space for probably people who see themselves as convicts in your organization? And for the other speakers or other presenters, is there a possibility of having something like a sanctuary city or a sanctuary town or sanctuary location that is devoid of illicit drugs that people can go and recover before they will go to other locations or other towns? Because this was my case about 20 years ago when I was an addict. I returned from Europe, and then I went to a smaller town in Nigeria. There was no drugs then, so I could recover myself, and I did not elapse. Because of it, I was able to enroll, go back to school, and get a university education, and now very soon I'll get a PhD. So is there any way to have such poles, you call it like growth pole in economics, where you have sanctuary towns that people can go and stay and recover? I mean, also collaborating with governments to make that happen.
Okay.
Thank you.
Thank you, Ngozi. Maybe Mateo, you can respond briefly about individual membership, and yeah.
Yeah, no problem. Ngozi, thank you for an excellent question and comments. Yes, the biggest advantage of civil society organizations is that we are in direct contact with pretty much all vulnerable populations in the ground. So that's the most important in our case. And also we are in direct contact with vulnerable groups such as victims of organized crime, drug trafficking, violence, etc. So of course, yeah, we among our membership, there are many such organizations which try to protect and work with this kind of vulnerable populations. And we're always very happy and not happy about the situation, but happy that we can include this in our discussions and try to find solutions together at the global level as well with the UN agencies. But also, I must say that we are also very happy that we are quite progressing with this building regional infrastructures, especially in Africa. This is important milestone, the establishment of African Civil Society Forum on Drugs, which could also give you another opportunity to be more engaged and involved in the policy and decision-making processes at African continent with the African Union's Commission. So we are trying to open as many channels as possible for you or for organizations dealing with difficult, vulnerable groups, and to improve situation at global and also at regional level. So I hope it makes sense, this answer.
Thank you, Matej. Perfectly makes sense for me, at least. I see Lilian also was willing to answer the question. Lilian?
Lilian, you are speaking, but you're muted.
Yeah,
you're muted.
I'm muted. I'm remove. I want to remove the video because
all right.
I think my internet is.
Okay, go ahead.
Let me see. Yes. Thank you. Did I hear a question for me? But I also have a concern from Mate. And one of those is that I'm happy one of us is in the circles of the civil society, the big wigs, but the propagators of silos are the civil societies, especially the donor, the ones that make the contracts with the funding. They are the main propagators, but because they are the ones who decide, don't go beyond this, stay here, not bending into. They really are the propagators of the silos. And I am hoping as Mate, you interact in those circles, you're able to influence breaking down the silo so that, for example, sex workers who are treated for HIV are also taken care of substance use disorders, as opposed to only HIV. Even when the indicators say the reason they cannot virus suppress is substance use disorder, yet the program will not do substance use disorder treatment because the silo is tied to only HIV. I'm sending you as our emissary to break the silos there, Mr. Mate, and we'll be appreciative. Another short thing, Ngozi, you're not a victim. That you're talking to us now, and you appear to be quite sober. You are a survivor, not a victim. Thank you.
Thank you, Lilian. I agree completely with you in the final statement as well. All right, Rogers, you had your hand up for some time.
Hello.
Hello.
Are you hearing me?
Yes, we are loud and clear.
Okay. I'm impressed with the sharing you had. Congratulations to our speakers, but also the audience, I'm sure, has benefited a lot. I had a question for Lilian, which I wanted to ask immediately, because the intersection between recovery, between prevention, recovery, and treatment sometimes is not clear. Might she have an idea of some of the clues one can take into consideration to know that I'm really at this stage and this is what I need to do? Thank you very much, everybody. Congratulations.
Thank you, Rogers, for the question. Lilian, would you?
I can go ahead.
Yes.
Okay, so thank you for that. That's a very brilliant question, which I'm sure Paul wanted that question asked. I don't know whether he texted you to ask that question, because I think that's what we need to answer. Where is the intersection? But the intersection in every program is different. For example, if a person is not using at all, you can use prevention and also tell them the effects of using and not using. But in the whole theoretical, the theory of change, we have areas, we have 5 areas of the theory of change, where we have pre-contemplation, where we provide information on not using or of using. So if a person wants to change their behavior, especially if they are using, they are given information, which is a similar information given to people who are not using. So general information for general population for prevention. So as you graduate, there are people who are going to start using, or those ones who are not going to be using. The ones who start using continue getting information on why the dangers. So the information gets different on what you're preventing. The objective of the information is what matters. But gradually, there are people who, in the whole group of people, some people will start using and get problematic use. So here we have prevention on escalation to SUD, so that it can go back, or harm reduction. So the prevention messages are different depending on one, the use. 2, who is it, a child, a grown-up? Is it, who is the person? What are they using? So prevention will happen, the information will happen there. So the areas of intersection there come depending on what is happening to the individual or the group of people. Why connecting the parallels is important is because when a person goes to the field, you're able to do everything. You're able to know, or can you do SBRIT? That is, SBRIT means, SBRIT is a screening, brief intervention, okay? And referral. That's a community-based activity that escalates a person to the next level. If the person is for rehab, it now takes them to a rehab. Is it outpatient, intensive outpatient, medical aid assisted? Are you going to go for inpatient facility? Or when the person comes out of a rehab, you come back to the community. We have prevention of relapse. Again, these are users who has come to the community back and they need to stay sober. But you need to avoid people, places, and things that make them relapse. So prevention continues there. So prevention goes around everywhere, the whole continuum of care, and prevention and treatment goes around the whole continuum of care for prevention of SUD. Now, I don't know whether that helps you, because the science of prevention intersects with the science of treatment. And I would like you to maybe read a little bit about that. The two intersect, but on the ground, we do not do it the same way. We go into silos. And I mentioned the why of the silos. Thank you.
Thank you, Lilian. Very clear answer. I think, at least I thought so, for summarizing it so well, since it's a very complex and big question in a way. I see Davice or Davis has his hand up. Would like to ask a question?
Yes. Sorry. Good evening from Kenya. My name is Davis. Sorry, it's Davis.
I apologize.
It's okay. Thank you so much, Lilian and Mate, and all other presenters. It's been very informative. Otherwise, when Mate was presenting, when it came to membership, I kept on hearing about NGO. Otherwise, I want to just make a simple request that since we work in the community, and I'm personally the director, Child Ambassadors Development, CAD, which is a community-based organization. We also allowed to join VNGOC. Thank you.
Yes, if you are a formally established entity, then of course you are eligible to be a member of VNGOC. So it's a very broad definition of NGO. So also community organizations. As soon as you are not a governmental, within the governmental structure, or you are non-profit, non-governmental, you're eligible to be member of VNGOC.
All right, thank you.
Thank you for your question. Thank you, Mate. Esther, I see you have your hand up.
Yes, my video is not working, so I'll only voice my concern. First, let me appreciate, and on behalf of NACADA, say that we are humbled that we are being recognized in the work we do in the community. I should say that community work group and technical working groups are the way to go if we are to gain our foot in terms of going into the community. Again, yes, somebody asked a question on whether there are safe places to go to if you do not want to use drugs. It is the initiative of the individual communities via the organizations to set up or to make safe environments for that, for those kind of people. In Kenya, we have a given location that we have no alcohol, no tobacco, no bangi sold in that area, just because of the community coming up and saying we do not want these things here. So it is actually the community, through our efforts and through empowering them on what their rights are, and they make a collective responsibility and say we do not want this here, and therefore it can be done. I actually work with NACADA. Thank you.
Thank you, Esther, for diving into the question by Ngozi and elaborating on that. Thank you so much. I see we have 2 more hands. I think after that we will have to call it a day, but first I would like to give George the floor, and after that, Brian.
Okay. Thank you, Cressida and the organizers of the conference. Allow me, first of all, to appreciate all the presenters for the good work that they've done. My question goes to Lillian. When she was responding, she talked about harm reduction. Maybe if she can explain a little bit about the harm reduction approach that she's using, because I know there is a HIV harm reduction approach, which is completely different with the harm reduction that we are trying to put in place when it comes to working with, because we also work with HIV clients who are on drugs. I think it would be more important that we have a clear explanation about the approaches. Then secondly, I wanted to ask, maybe this is a recommendation for the future. In Africa, I think we have children, youth, and the older people. And in most cases, we realize that we work with the young people, assuming that they are the youth. So if we could organize conferences such as this and consider the young people between the ages of 18 to 35 to actively participate, because if you look at the data, you realize that they are the worst hit victims. And at times we organize a session, you realize that we want to prevent, we engage the young people, which is a good thing. But where is the voice of this young person who has lost hope and is into drugs and he wants a way out? So if we can engage them and give them more platform, I think it will be more important, because we have to change the approach so that we are able to win against this issue of drug and substance abuse. And then finally, again, this goes to Lillian, the approach of the children in the family setup. As much as we are focusing so much on the client, how do we bring in the aspect of prevention to this young person who has a father who has been affected with drug and substance use? Because if we focus so much on the father, the mother, where do we put on the child? Because the child will not take it lightly when a father tells him, stop taking drugs, as a way of trying to promote prevention, because he has seen how drugs has led the father to be. But if a social worker or a counselor comes in and engage the child, you know, so I just wanted to understand from Lillian, where is the voice of this child who comes from this family that has been affected? Thank you very much for the opportunity.
Thank you, George. Lillian?
I can proceed. Yeah, thank you, George, for a great question. Now, let me start with the nearest one, the easiest one, actually, the children issue. I mean, I don't have data, but I have practical experience in Kisumu. What are we doing to answer that question? Having a technical working group or a community work group allows any player in the community to come together and everybody knows who's doing what, where, when. Now, as a person who is in treatment, I would be targeting the person already in substance use. Fortunately, we work with other community-based groups that are working with children. We have Blue Cross working with children. We have Crime People working with children. And once they have the children, they have the mother, they have the child. So there are evidence-based ways of working with children who are in situations like those ones. And NACADA has a curriculum that are for age-appropriate groups. So for prevention. Also, when the parents are found, we have also a program for positive parenting. Positive parenting ensures, takes care of the parent who is using, even those ones who are not using, enlightening them on the effects of their use to their children, because normally they think they are using and the children are affected. So that is made away, they are made aware of that. then so that kind of collaborative action is hopes to leave nobody falling through the cracks, because you take the parent, I take the parents for substance use disorder, and Blue Cross and other NGOs, we have also CAD who are working with children, taking care of the children. If you are working in a place like George would know, a place like Manyata, Obunga, the children you are dealing with will be exposed to substances, either in the neighborhood or in their own houses. So already they are taken care of as suspects already, because you're discussing with them as people who have seen alcohol use or even have experimented a bit. So we working with other CSOs and NGOs makes it possible to catch the children and take care of the parent. Okay, and of course the recovery. Now the first question on harm reduction. Harm reduction in the continuum of care. There are people who are already using. For example, there are women who use drugs, and like says people like sex workers. Sex workers are already using drugs to be able to do sex work. Okay, now, or they are using substance use as a coping mechanism. So as a psychologist, your business is to ensure you alleviate the pain. It may be that they have to either get out of sex work or use substances that they don't get injured. So harm reduction is very tied to ensuring the person gets less harm from the substance by referring to the relevant services. For example, SRH, you mentioned HIV, GBV services, and ensuring that they're able to access those services without stigma and discrimination. So harm reduction looks like that. Of course, it's not watertight. We are still work in progress, but ideally that is what happens. Thank you.
Thank you so much, Lilian, for that. Next question, the final question, Brian.
Mine will be so short. Thank you so much, Lilian, and the presenter. It was really great. I hope Matej has not jumped off, because my question was going to him directly. Yes, it's Elon. Like Esther, I also come from the government side, and I'm glad to be part of this meeting to hear what the CSOs are talking about. Matej, in your presentation, you talked about so much about collaboration with UN agencies, governments, and all that. Have you put a platform, a practical platform, a visible platform where once in a while government can come in and listen into what the CSOs are thinking, what they can transfer into policy, what they can transfer into standards? Is that platform there, and how can one easily access it? Thank you so much.
Thank you for your question. I think I mentioned this collaboration a lot because I think this is crucial for the future of our work together in drug policy. Because governments have their own responsibilities, they have budget, they can prioritize in strategies and action plans. And if they can do it with academia, with civil society organizations, with other services, to create an integrated system of services, a kind of referral system, the whole continuum of care structure, then we have chance to, if I'm able to say, to win this battle. Otherwise, if we are isolated, like governments isolated, NGOs isolated, health and social services isolated, law enforcement isolated, we are not going anywhere. The situation will be worse and worse and worse. And if we want to move things further in the positive direction, then we need to establish this kind of collaboration systems and platforms, or at global level, regional level, national level, local level, in a way, in the sense of building community teams or community prevention teams, community drug demand reduction teams, no matter how they are called. But we have to focus our work, if we are serious in drug policy, to build this kind of structures and collaborations and develop strategies and action plans together. Focus on evidence-based, avoid duplication of work, of overlaps, because at the moment, if you go to, my country, Slovenia, is a very small country. It's a 2 million country, but there is so much overlapping in schools, in social services, in healthcare services, that sometimes I feel like I feel crazy, because I work in this field already for more than 25 years. I'm telling them all the time, but we are still going nowhere. But at least there is something written in the strategy or action plan that there should be a collaboration. But operationalization and implementation of these strategies, that's the problem. So we have to raise our voice as a civil society, as a government, and bring this topic as high as possible at the political agenda and discuss, the importance of building these collaborative infrastructures where every single important stakeholder would be involved in and contribute to this process. If we are not honest about it, then just forget it. We will discuss about these topics over and over again and struggle with different challenges. We will be desperate and shocked with the new numbers in the World Drug Report every year. That would be the future if we do nothing in the next few years into this direction of building collaborative infrastructures. That's the main purpose also of Impact Coalition, which I'm so much in favor in, but I know that there are several other interpretations of Impact Coalition, so different interests want to overcome or overtake the leadership and so on, but I will strictly stand on this position of collaborative strategy. And those who has to show initiatives, this kind of initiatives at your national or regional level, are more than welcome to join us, and we will push you in the front lines and show others that this is possible. I hope I was not too long.
No, you're very clear. Thank you. Thank you for the final good statement of this webinar. Paul, I don't know, you want...
Brian, keep pushing your initiative in your country towards this direction. We are really appreciating your efforts. Thank you.
Thank you. We are indeed. Paul, I will let you do the final words of today. I want to say at least thank you all for staying on for so long, and half an hour longer than originally scheduled. Thank you for all the speakers for great presentations and very insightful presentations. This was very much appreciated, and I think we all, including myself, learned a lot from it. And thank you, Paul, for your great moderation and being a great organizer and partner in this sense. And I would like to hand over the word to you for the final words as our moderator of today.
Thank you very much, Cressida, and everyone else. Am I audible? I seem to have hung.
No, you're audible.
All right. Yeah, I don't think I would have much because you already, sent the vote of thanks. I would only want also to recognize those from the government so that joined us. We are so glad that you could have that time and just have an insight of what we are discussing from the civil society. We really appreciate you. And everyone else from the East African region. And also I saw quite a number of participants from West Africa, specifically from Nigeria. I think there were 3 or 4. participants from that side. And we want to say that this is not just an East African affair. We know that we are a continent with similar challenges, and therefore we are welcome anytime to join in such like discussions. And also when you plan yours, we'd also be willing to join. So thank you so much, and maybe we shall just give a way forward after this once we just maybe discuss one or two things with Cressida and other people who are involved in this, George and the rest. And then I believe we shall be getting back on what next, and maybe another workshop, maybe if time and resources allow. We definitely still wish to have in-person kind of interactions. They are very effective, but then we are all aware of the constraints that we are facing, but we believe that we can overcome all such challenges. So to Mate, especially many questions have been directed to you. I believe we are going to reap the maximum benefits of your being at that position. And yes, for us who have interacted with you, you already know that you're very principled, and you mean well for the community, for our region. So we shall be there to vote for you again and again. And we encourage every one of us to join both WFAD and the BNGOC platform, even as we strengthen our African civil society group here in Africa. So I would say thank you, and just get ready for a cup of tea from Kenya. As we say, have a nice evening. Yeah. Not unless there is any, we can just maybe open our videos and just say hello to each other. Please, if you're there, you can, Thank you so much.
See you next time.
Thank you all. Thank you, Cressida. Thank you, Olivia.
Thank you.
See you next time.
Bye-bye.
Bye-bye.
Thank you.
Bye.
Thank you. Enjoy your tea, and see you next time.
Thank you.
Bye.
Bye.
Yes.